1. What neurotransmitter deficiency is primarily responsible for the symptoms of Parkinson's disease? A. Serotonin. B. Dopamine. C. Acetylcholine. D. GABA. Answer: dopamine. Rationale: Parkinson's disease results from the degeneration of dopaminergic neurons in the substantia nigra, leading to dopamine deficiency. Dopamine regulates voluntary motor activity. Serotonin and acetylcholine are involved in other functions, but not the primary cause of Parkinson's. GABA is an inhibitory neurotransmitter unrelated to the core pathology. 2. Which of the following is the hallmark motor symptom of Parkinson's disease? A. Tremor at rest. B. Diplopia. C. Muscle spasm. D. Loss of sensation. Answer: tremor at rest. Rationale: a resting tremor is a cardinal motor symptom of Parkinson's disease, often starting in one hand. Diplopia and loss of sensation are not typical of Parkinson's. Muscle spasm may occur, but is not a defining feature. 3. What is the primary diagnostic tool for Parkinson's disease? A. Blood test. B. MRI scan. C. Clinical examination. D. Lumbar puncture. Answer: clinical examination. Rationale: Parkinson's disease is diagnosed clinically based on the presence of motor symptoms and response to dopaminergic therapy. Imaging MRI may rule out other conditions, but is not diagnostic. Blood tests and lumbar punctures are not useful for diagnosing Parkinson's disease. 4. Which medication is considered the first-line treatment for Parkinson's disease? A. Levodopa-carbidopa. B. Gabapentin. C. Amantadine. D. Propranolol. Answer: levodopa-carbidopa. Rationale: levodopa-carbidopa is the gold standard treatment for Parkinson's disease, as it replenishes dopamine levels. Gabapentin is for neuropathic pain, amantadine is used for dyskinesia, and propranolol is for tremors unrelated to Parkinson's. 5. A patient with Parkinson's disease is experiencing wearing off symptoms. What is the best intervention? A. Increase the levodopa dose. B. Stop all medications. C. Add a COMT inhibitor. D. Recommend bed rest. Answer: add a COMT inhibitor. Rationale: wearing off symptoms occur as levodopa's effect diminishes. COMT inhibitors, e.g., entacapone, extend the duration of levodopa's action. Increasing the dose may cause side effects, and stopping medications worsens symptoms. Bed rest is unnecessary. 6. What brain structure primarily degenerates in Parkinson's disease? A. Hippocampus. B. Substantia nigra. C. Thalamus. D. Cerebellum. Answer: substantia nigra. Rationale: the substantia nigra is the brain structure primarily affected in Parkinson's disease. The loss of dopaminergic neurons in this area leads to motor dysfunction. The hippocampus is related to memory, the thalamus relays sensory signals, and the cerebellum coordinates movement, but is not the primary site of degeneration in Parkinson's. 7. Which symptom is considered a non-motor manifestation of Parkinson's disease? A. Bradykinesia. B. Resting tremor. C. Depression. D. Rigidity. Answer: depression. Rationale: depression is a common non-motor symptom of Parkinson's disease. Bradykinesia, resting tremor, and rigidity are motor symptoms. 8. Which dietary recommendation is important for patients taking levodopa? A. Increase protein intake. B. Consume high-fat meals. C. Take with a high-protein meal. D. Avoid high-protein meals near medication times. Answer: avoid high-protein meals near medication times. Rationale: high-protein meals can interfere with the absorption of levodopa, reducing its effectiveness. Patients are advised to separate protein intake from medication administration. 9. What is the typical initial symptom of Parkinson's disease? A. Bilateral tremor. B. Gait disturbances. C. Unilateral resting tremor. D. Sudden cognitive decline. Answer: unilateral resting tremor. Rationale: the disease often starts with a unilateral resting tremor. Gait disturbances and bilateral symptoms develop later, and cognitive decline occurs in advanced stages. 10. Which class of drugs is often used as adjunct therapy to reduce off periods in Parkinson's disease? A. Anticholinergics. B. COMT inhibitors. C. Beta blockers. D. Benzodiazepines. Answer: COMT inhibitors. Rationale: COMT inhibitors prolong the action of levodopa, reducing OFF periods. Anticholinergics help with tremors, but are not used for this purpose. Beta blockers and benzodiazepines are not standard treatments for Parkinson's. 11. What is the hallmark histopathological feature of Parkinson's disease? A. Neurofibrillary tangles. B. Amyloid plaques. C. Lewy bodies. D. Tau protein deposits. Answer: Lewy bodies. Rationale: Lewy bodies, composed of alpha-synuclein, are the hallmark pathological feature of Parkinson's disease. Neurofibrillary tangles and amyloid plaques are seen in Alzheimer's disease. 12. Which symptom of Parkinson's disease is described as a resistance to passive movement? A. Tremor. B. Rigidity. C. Bradykinesia. D. Dyskinesia. Answer: rigidity. Rationale: rigidity refers to increased resistance to passive movement. Tremor involves rhythmic shaking, bradykinesia is slow movement, and dyskinesia refers to involuntary movements. 13. Deep brain stimulation, DBS, is most effective in treating which symptom of Parkinson's disease? A. Cognitive decline. B. Dysphagia. C. Motor fluctuations. D. Depression. Answer: motor fluctuations. Rationale: DBS is used to treat motor fluctuations and tremors in Parkinson's disease. It does not directly address cognitive decline, dysphagia, or depression. 14. Which neurotransmitter imbalance characterizes Parkinson's disease? A. Increased serotonin and decreased dopamine. B. Decreased dopamine and increased acetylcholine. C. Increased GABA and decreased norepinephrine. D. Increased dopamine and decreased serotonin. Answer: decreased dopamine and increased acetylcholine. Rationale: Parkinson's disease is characterized by a deficiency of dopamine and a relative increase in acetylcholine activity. 15. What is the primary goal of pharmacological management in Parkinson's disease? A. Cure the disease. B. Enhance dopamine levels. C. Increase GABA activity. D. Reduce acetylcholine levels. Answer: enhance dopamine levels. Rationale: the primary goal of pharmacological management is to enhance dopamine levels or mimic its effects to alleviate motor symptoms. Parkinson's disease cannot be cured. 16. Which symptom is not typically associated with Parkinson's disease? A. Postural instability. B. Muscle weakness. C. Bradykinesia. D. Resting tremor. Answer: muscle weakness. Rationale: muscle weakness is not a primary feature of Parkinson's disease. Postural instability, bradykinesia, and resting tremor are common symptoms. 17. What is the purpose of adding carbidopa to levodopa therapy? A. To prevent tremors. B. To increase dopamine degradation. C. To reduce peripheral metabolism of levodopa. D. To inhibit acetylcholine release. Answer: to reduce peripheral metabolism of levodopa. Rationale: carbidopa inhibits the peripheral breakdown of levodopa, increasing its availability to the brain. It does not directly prevent tremors or affect acetylcholine. 18. What type of gait is commonly seen in Parkinson's disease? A. Ataxic gait. B. Spastic gait. C. Shuffling gait. D. Steppage gait. Answer: shuffling gait. Rationale: patients with Parkinson's disease often exhibit a shuffling gait with short, hesitant steps. Ataxic gait is seen in cerebellar disorders, spastic gait in upper motor neuron lesions, and steppage gait in peripheral neuropathy. 19. Which drug class can cause Parkinson-like symptoms as a side effect? A. Beta blockers. B. Anticholinergics. C. Dopamine agonists. D. Antipsychotics. Answer: antipsychotics. Rationale: antipsychotics block dopamine receptors and can induce Parkinsonism. Dopamine agonists treat Parkinson's, and anticholinergics are used for tremors. Beta blockers do not cause Parkinsonism. 20. What is a potential adverse effect of long-term levodopa therapy? A. Bradykinesia. B. Dyskinesias. C. Muscle rigidity. D. Hypertension. Answer: dyskinesias. Rationale: long-term levodopa therapy can lead to dyskinesias, involuntary movements. Bradykinesia and muscle rigidity are symptoms of Parkinson's, not medication side effects. 21. Which assessment tool is commonly used to monitor the severity of Parkinson's disease symptoms? A. Mini Mental State Examination, MMSE. B. Unified Parkinson's Disease Rating Scale, UPDRS. C. Glasgow Coma Scale, GCS. D. Barthel Index. Answer: Unified Parkinson's Disease Rating Scale, UPDRS. Rationale: the UPDRS assesses motor and non-motor symptoms of Parkinson's disease. The MMSE evaluates cognitive function, the GCS assesses consciousness, and the Barthel Index measures functional independence. 22. What is the on-off phenomenon in Parkinson's disease? A. Sudden worsening of cognitive symptoms. B. Fluctuations in motor function related to medication levels. C. Gradual loss of medication efficacy. D. Complete symptom remission. Answer: fluctuations in motor function related to medication levels. Rationale: the on-off phenomenon refers to sudden fluctuations in motor function as medication levels rise and fall. It does not involve cognitive symptoms or complete symptom remission. 23. Which lifestyle modification can help improve Parkinson's disease symptoms? A. Reducing physical activity. B. High-fat diet. C. Regular physical exercise. D. Avoiding all social interactions. Answer: regular physical exercise. Rationale: regular physical exercise can improve mobility, balance, and overall well-being in patients with Parkinson's disease. Reducing activity and social isolation are detrimental. 24. Which complication is associated with advanced Parkinson's disease? A. Liver failure. B. Respiratory depression. C. Dysphagia. D. Hyperthyroidism. Answer: dysphagia. Rationale: dysphagia, difficulty swallowing, is a common complication in advanced Parkinson's disease. Respiratory depression and liver failure are not typical complications. Hyperthyroidism is unrelated. 25. Which non-motor symptom might a caregiver notice in a patient with Parkinson's disease? A. Increased energy levels. B. Excessive sweating. C. Improved memory. D. Heightened appetite. Answer: excessive sweating. Rationale: excessive sweating is a common autonomic non-motor symptom of Parkinson's disease. Memory may decline, and appetite is often reduced. 26. What is the primary role of dopamine agonists in Parkinson's disease management? A. Replace acetylcholine. B. Mimic dopamine activity. C. Inhibit dopamine reuptake. D. Stimulate serotonin receptors. Answer: mimic dopamine activity. Rationale: dopamine agonists mimic dopamine activity, reducing motor symptoms. They do not replace acetylcholine or affect serotonin. 27. What is the primary side effect associated with dopamine agonists in Parkinson's disease treatment? A. Hallucinations. B. Bradycardia. C. Constipation. D. Hyperglycemia. Answer: A. Hallucinations. Rationale: dopamine agonists can cause hallucinations, particularly in older patients. Bradycardia and hyperglycemia are not typical side effects. 28. Which test is used to confirm the diagnosis of Parkinson's disease? A. MRI. B. CT scan. C. Clinical examination. D. Blood test for dopamine levels. Answer: C. Clinical examination. Rationale: diagnosis is primarily clinical based on history and physical examination. Imaging tests are used to rule out other conditions. 29. A nurse assesses a Parkinson's patient who is experiencing frequent falls. What symptom is most likely contributing? A. Bradykinesia. B. Postural instability. C. Resting tremor. D. Dysphagia. Answer: B. Postural instability. Rationale: postural instability is a major cause of falls in Parkinson's patients. 30. What advice should a nurse give to a Parkinson's patient about freezing episodes during walking? A. Take faster steps. B. Avoid walking altogether. C. March in place or visualize stepping over an object. D. Use sedatives before walking. Answer. C. March in place or visualize stepping over an object. Rationale. Techniques like marching in place help overcome freezing episodes. 31. Which surgical procedure is used to treat advanced Parkinson's disease? A. Coronary bypass. B. Deep brain stimulation, DBS. C. Spinal cord stimulation. D. Thalamotomy. Answer. B. Deep brain stimulation, DBS. Rationale. DBS is commonly used to reduce motor symptoms in advanced Parkinson's disease. 32. Which activity can help maintain motor function in Parkinson's patients? A. Long periods of bed rest. B. Stretching and balance exercises. C. Avoiding physical activity. D. High-impact sports. Answer. B. Stretching and balance exercises. Rationale. Stretching and balance exercises help improve motor function and prevent falls. 33. Why should anticholinergic medications be used cautiously in older Parkinson's patients? A. They can cause weight gain. B. They may lead to cognitive impairment. C. They decrease dopamine production. D. They increase acetylcholine levels. Answer. B. They may lead to cognitive impairment. Rationale. Anticholinergics can cause confusion and memory issues, particularly in elderly patients. 34. What is the best description of dysphagia in Parkinson's disease? A. Difficulty initiating movement. B. Difficulty swallowing. C. Involuntary muscle contractions. D. Loss of balance. Answer. B. Difficulty swallowing. Rationale. Dysphagia can lead to aspiration pneumonia in Parkinson's patients. 35. Which symptom is an autonomic manifestation of Parkinson's disease? A. Bradykinesia. B. Orthostatic hypotension. C. Tremor. D. Rigidity. Answer. B. Orthostatic hypotension. Rationale. Autonomic dysfunction in Parkinson's disease may lead to orthostatic hypotension. 36. What is a recommended dietary change for patients with Parkinson's disease experiencing constipation? A. Increase fat intake. B. Reduce fluid consumption. C. Increase fiber and fluid intake. D. Follow a high-protein diet. Answer. C. Increase fiber and fluid intake. Rationale. Increasing fiber and fluids helps alleviate constipation. 37. A patient with Parkinson's disease reports vivid dreams and hallucinations. Which medication is likely responsible? A. Carbidopa. B. Entacapone. C. Ropinirole. D. Aspirin. Answer. C. Ropinirole. Rationale. Dopamine agonists like ropinirole can cause vivid dreams and hallucinations. 38. What symptom differentiates Parkinson's disease from other tremor disorders? A. Postural tremor. B. Action tremor. C. Resting tremor. D. Intention tremor. Answer. C. Resting tremor. Rationale. Resting tremor is a hallmark of Parkinson's disease, unlike action or intention tremors. 39. Which lifestyle modification can help reduce off periods in Parkinson's disease? A. Smoking cessation. B. Maintaining a consistent medication schedule. C. Eating high-protein meals before medication. D. Reducing exercise. Answer. B. Maintaining a consistent medication schedule. Rationale. Consistent medication timing helps reduce off periods. 40. Which cognitive symptom is common in Parkinson's disease? A. Improved attention span. B. Memory improvement. C. Impaired executive function. D. Enhanced problem-solving skills. Answer. C. Impaired executive function. Rationale. Cognitive changes in Parkinson's often include difficulties with planning, organizing, and decision-making. 41. What is the primary goal of levodopa therapy in Parkinson's disease? A. Cure the disease. B. Increase dopamine levels in the brain. C. Reduce serotonin levels. D. Increase acetylcholine production. Answer. B. Increase dopamine levels in the brain. Rationale. Levodopa is converted to dopamine in the brain, alleviating motor symptoms. It does not cure the disease. 42. Which symptom indicates the presence of Parkinson's disease-related dyskinesia? A. Muscle weakness. B. Involuntary muscle movements. C. Loss of muscle tone. D. Bradykinesia. Answer: B. Involuntary muscle movements. Rationale: dyskinesia involves abnormal, involuntary movements and is often a side effect of long-term levodopa use. 43. What is the role of MAOB inhibitors in Parkinson's disease management? A. Prevent serotonin breakdown. B. Reduce muscle rigidity. C. Prevent dopamine breakdown. D. Increase dopamine release. Answer: C. Prevent dopamine breakdown. Rationale: MAOB inhibitors, such as selegiline, block dopamine breakdown, prolonging its action. 44. A patient with Parkinson's reports worsening symptoms after meals. Which dietary adjustment might help? A. Decrease carbohydrate intake. B. Consume high-fat meals. C. Take medication 30 minutes before meals. D. Increase protein intake. Answer: C. Take medication 30 minutes before meals. Rationale: levodopa absorption can be impaired by dietary proteins. Taking it before meals improves effectiveness. 45. Which type of exercise is particularly beneficial for Parkinson's patients to improve balance and flexibility? A. Weightlifting. B. Tai Chi. C. High-impact aerobics. D. Sprinting. Answer: B. Tai Chi. Rationale: Tai Chi improves balance, flexibility, and reduces the risk of falls. 46. Which complication of Parkinson's disease involves difficulty swallowing and an increased risk of aspiration? A. Bradykinesia. B. Dysphagia. C. Postural instability. D. Rigidity. Answer: B. Dysphagia. Rationale: dysphagia increases the risk of aspiration and pneumonia in Parkinson's patients. 47. Which symptom would most likely prompt a provider to initiate deep brain stimulation, DBS, for a Parkinson's patient? A. Early tremors. B. Mild gait disturbances. C. Medication-resistant motor fluctuations. D. Mild cognitive decline. Answer: C. Medication-resistant motor fluctuations. Rationale: DBS is recommended for patients with severe motor symptoms unresponsive to medications. 48. Which neurotransmitter imbalance characterizes Parkinson's disease? A. Increased serotonin and decreased acetylcholine. B. Decreased dopamine and increased acetylcholine. C. Increased norepinephrine and decreased dopamine. D. Decreased serotonin and increased dopamine. Answer: B. Decreased dopamine and increased acetylcholine. Rationale: Parkinson's results from dopamine deficiency and a relative excess of acetylcholine. 49. What should the nurse prioritize when teaching a Parkinson's patient about home safety? A. Use dim lighting. B. Avoid handrails on stairs. C. Remove tripping hazards like rugs. D. Encourage walking without assistive devices. Answer: C. Remove tripping hazards like rugs. Rationale: removing tripping hazards prevents falls, which are common due to postural instability. 50. Which strategy helps manage freezing episodes during movement in Parkinson's disease? A. Visualizing stepping over an object. B. Increasing walking speed. C. Avoiding physical activity. D. Standing still for prolonged periods. Answer: A. Visualizing stepping over an object. Rationale: visual cues help overcome freezing episodes by breaking the movement pattern. 51. Which of the following is a non-motor symptom commonly associated with Parkinson's disease? A. Tremors. B. Hypophonia. C. Bradykinesia. D. Muscle rigidity. Answer: B. Hypophonia. Rationale: hypophonia, soft speech, is a common non-motor symptom of Parkinson's disease due to vocal cord dysfunction. 52. What is the primary purpose of administering carbidopa with levodopa in Parkinson's disease treatment? A. To reduce the side effects of dopamine. B. To prevent the breakdown of levodopa before it reaches the brain. C. To increase the absorption of levodopa. D. To prevent the breakdown of dopamine in the brain. Answer: B. To prevent the breakdown of levodopa before it reaches the brain. Rationale: carbidopa inhibits the conversion of levodopa into dopamine in the periphery, allowing more levodopa to reach the brain. 53. Which complication of Parkinson's disease is associated with a higher risk of mortality? A. Increased tremors. B. Cognitive decline and dementia. C. Muscle rigidity. D. Sleep disturbances. Answer: B's cognitive decline and dementia. Rationale: cognitive decline and dementia significantly impact the quality of life and are associated with higher mortality rates in Parkinson's disease. 54. In Parkinson's disease, which area of the brain is primarily affected by the degeneration of dopaminergic neurons? A. Cerebellum. B. Basal ganglia. C. Medulla oblongata. D. Hippocampus. Answer: B. Basal ganglia. Rationale: the basal ganglia, specifically the substantia nigra, is the primary area affected in Parkinson's disease. 55. A patient with Parkinson's disease experiences difficulty initiating movement. What term describes this symptom? A. Dyskinesia. B. Akinesia. C. Rigidity. D. Bradykinesia. Answer: B. Akinesia. Rationale: akinesia refers to the inability to initiate movement, which is common in Parkinson's disease. 56. What is the most common initial presenting symptom of Parkinson's disease? A. Cognitive changes. B. Tremor at rest. C. Postural instability. D. Rigidity. Answer: B. Tremor at rest. Rationale: resting tremors are often the first noticeable symptom of Parkinson's disease, although other symptoms may develop later. 57. What is the main function of dopamine agonists in Parkinson's disease management? A. They increase dopamine production. B. They mimic dopamine in the brain. C. They prevent the breakdown of dopamine. D. They block acetylcholine activity. Answer: B. They mimic dopamine in the brain. Rationale: dopamine agonists mimic the effect of dopamine on receptors in the brain, helping alleviate symptoms. 58. What is the most common cause of death in patients with advanced Parkinson's disease? A. Cardiac arrest. B. Aspiration pneumonia. C. Stroke. D. Renal failure. Answer: B. Aspiration pneumonia. Rationale: due to dysphagia, Parkinson's patients are at a higher risk of aspiration, leading to pneumonia and subsequent complications. 59. Which medication is commonly used to help manage Parkinson's disease-related cognitive symptoms? A. Haloperidol. B. Rivastigmine. C. Levodopa. D. Diazepam. Answer: B. Rivastigmine. Rationale: rivastigmine, an acetylcholinesterase inhibitor, is used to manage cognitive symptoms like dementia in Parkinson's disease. 60. A Parkinson's patient presents with excessive daytime sleepiness. Which of the following is most likely contributing to this symptom? A. Levodopa therapy. B. MAOB inhibitors. C. Anticholinergic medications. D. Deep brain stimulation. Answer: A. Levodopa therapy. Rationale: levodopa therapy can cause side effects like excessive daytime sleepiness, especially in high doses. 61. Which of the following is the most appropriate intervention for managing postural instability in Parkinson's disease? A. Medications only. B. Physical therapy and balance training. C. Deep brain stimulation. D. Nutritional support. Answer: B. Physical therapy and balance training. Rationale: postural instability is best managed with physical therapy and balance exercises, which improve coordination and reduce the risk of falls. 62. What is the role of COMT inhibitors in the treatment of Parkinson's disease? A. They increase dopamine release in the brain. B. They reduce the breakdown of levodopa. C. They block dopamine receptors. D. They increase serotonin levels. Answer: B. They reduce the breakdown of levodopa. Rationale: COMT inhibitors, e.g., entacapone, help prolong the effects of levodopa by inhibiting its breakdown in the periphery. 63. Which of the following is a common side effect of dopaminergic medications in Parkinson's disease treatment? A. Tachycardia. B. Impulse control disorders. C. Hyperglycemia. D. Hypotension. Answer: B. Impulse control disorders. Rationale: dopaminergic medications in Parkinson's disease can cause impulse control disorders, including gambling and hypersexuality. 64. A patient with Parkinson's disease reports worsening of symptoms at the end of the day. This phenomenon is known as A. Motor fluctuations. B. Wearing off effect. C. Freezing of gait. D. On-off phenomenon. Answer: B. Wearing off effect. Rationale: the wearing off effect occurs when the effects of dopaminergic medications wear off before the next dose, leading to worsening of symptoms. 65. Which of the following symptoms is most indicative of the early stages of Parkinson's disease? A. Rigidity and bradykinesia. B. Resting tremor and postural instability. C. Memory loss and confusion. D. Dysphagia and dysarthria. Answer: A. Rigidity and bradykinesia. Rationale: early Parkinson's symptoms typically include rigidity and bradykinesia, with tremors appearing later. 66. Which of the following treatments is considered the most effective for managing motor symptoms in Parkinson's disease? A. Levodopa/carbidopa combination therapy. B. Monoamine oxidase B inhibitors. C. Acetylcholinesterase inhibitors. D. Dopamine agonists. Answer: A. Levodopa/carbidopa combination therapy. Rationale: levodopa/carbidopa therapy is the most effective treatment for motor symptoms by replenishing dopamine in the brain. 67. Which of the following is an example of a non-motor symptom of Parkinson's disease? A. Resting tremor. B. Bradykinesia. C. Depression. D. Rigidity. Answer: C. Depression. Rationale: depression is a common non-motor symptom of Parkinson's disease and can be addressed with antidepressants and psychological support. 68. What is the primary goal of deep brain stimulation, DBS, in Parkinson's disease treatment? A. To reverse the disease process. B. To alleviate symptoms of Parkinson's disease by modulating brain activity. C. To provide long-term relief from medication side effects. D. To improve cognition. Answer: B. To alleviate symptoms of Parkinson's disease by modulating brain activity. Rationale: DBS is used to reduce symptoms by sending electrical impulses to specific areas of the brain that control movement. 69. What is the main effect of anticholinergic medications in Parkinson's disease treatment? A. To increase dopamine production. B. To improve memory. C. To reduce tremors and rigidity. D. To enhance physical strength. Answer: C. To reduce tremors and rigidity. Rationale: anticholinergics, e.g., trihexyphenidyl, are used to manage tremors and rigidity by blocking acetylcholine activity in the brain. 70. Which of the following is the most appropriate diet recommendation for a patient with Parkinson's disease? A. High-protein diet. B. Low-carbohydrate diet. C. Increased fluid intake and a balanced diet. D. A low-sodium, low-fat diet. Answer: C. Increased fluid intake and a balanced diet. Rationale: adequate hydration and a balanced diet are essential in Parkinson's disease to maintain overall health and prevent complications like constipation. 71. Which of the following symptoms is most characteristic of Parkinson's disease-related cognitive decline? A. Forgetfulness and memory loss. B. Impulsive behaviors. C. Hallucinations and delusions. D. Poor concentration and executive dysfunction. Answer: D. Poor concentration and executive dysfunction. Rationale: cognitive decline in Parkinson's disease is commonly associated with poor concentration, executive dysfunction, and difficulty with planning and decision-making. 72. A patient with Parkinson's disease is experiencing freezing episodes where they are unable to move. Which of the following interventions may help alleviate this symptom? A. Increased doses of levodopa. B. Use of walking aids and cues. C. Physical restraint. D. Complete bed rest. Answer: B. Use of walking aids and cues. Rationale: freezing episodes are common in Parkinson's disease and can be alleviated by using walking aids or employing cues, e.g., visual or auditory cues, to help initiate movement. 73. A common complication of Parkinson's disease that affects swallowing is known as A. Dysphagia. B. Dysarthria. C. Apraxia. D. Ataxia. Answer: A. Dysphagia. Rationale: dysphagia, difficulty swallowing, is a common complication of Parkinson's disease due to impaired motor control of the muscles involved in swallowing. 74. Which of the following is the most common motor symptom of Parkinson's disease? A. Resting tremor. B. Bradykinesia. C. Postural instability. D. Rigidity. Answer: B. Bradykinesia. Rationale: bradykinesia, slowness of movement, is considered the hallmark symptom of Parkinson's disease and is often the most debilitating. 75. What is the most appropriate intervention for managing Parkinson's disease-related depression? A. Antidepressants and psychotherapy. B. Dopamine agonists. C. Physical therapy. D. Deep brain stimulation. Answer: A. Antidepressants and psychotherapy. Rationale: depression is common in Parkinson's disease and should be managed with antidepressants and psychotherapy as opposed to using dopaminergic medications. 76. Which of the following is a key feature of Parkinson's disease diagnosis? A. Positive genetic test. B. Presence of a resting tremor. C. MRI showing brain atrophy. D. Presence of hallucinations. Answer: B. Presence of a resting tremor. Rationale: the presence of a resting tremor, along with other clinical features like bradykinesia and rigidity, is often key in diagnosing Parkinson's disease. 77. Which class of medication is typically the first-line treatment for Parkinson's disease? A. Anticholinergics. B. Dopamine agonists. C. Levodopa/carbidopa. D. MAOB inhibitors. Answer: C. Levodopa/carbidopa. Rationale: levodopa/carbidopa is the most effective first-line treatment for motor symptoms in Parkinson's disease. 78. What is a potential side effect of deep brain stimulation (DBS) in Parkinson's disease? A. Increased risk of infection. B. Improved cognitive function. C. Increased tremor. D. Sudden sleep attacks. Answer: A. Increased risk of infection. Rationale: deep brain stimulation carries a risk of infection at the site of the implanted device, and proper wound care is essential to minimize this risk. 79. Which of the following non-motor symptoms in Parkinson's disease may require management with a speech therapist? A. Resting tremor. B. Dysphagia. C. Cognitive decline. D. Postural instability. Answer: B. Dysphagia. Rationale: dysphagia, difficulty swallowing, is a non-motor symptom that can be managed by speech therapists to prevent aspiration and improve swallowing function. 80. A patient with Parkinson's disease has developed excessive daytime sleepiness. Which of the following medications is most commonly associated with this side effect? A. Levodopa. B. Amantadine. C. Dopamine agonists. D. MAOB inhibitors. Answer: C. Dopamine agonists. Rationale: dopamine agonists, e.g., pramipexole, are commonly associated with excessive daytime sleepiness and other sleep-related issues in Parkinson's disease.